Are veterans getting adequate health care and other benefits from the multi-billion-dollar funded Veterans Administration? Congress, the American people are asking this question. Ed, what's your take on this depressing issue?
Well, it is depressing. I mean, promises are made to veterans that will provide health care for them. And, you know, back when this started, I think, after World War II, the Veterans Administration, you guys can correct me on this, because you're all older.
We've established that
If
already.
you'd
Okay, go
like, if
ahead.
you'd like to. It's the fact that at that particular time, that was top care. And the medical profession in our country really, I don't believe, was up to what the VA had in place. Now that's flipped. Our current medical system is much more advanced than the care that's currently being received, I believe, at most VA centers. The sad part is that it's not even a care issue. It's the fact that the veterans aren't even getting the care. They're being made to wait. Many of them are dying. And what's really, I think, disgusting to me is it's now become a political issue.
Sure.
We have Hillary Clinton saying that this is not really a big deal, and this is something that the Republicans are simply putting forward to garnish votes. And I don't want this to become a political issue. In fact, veterans ought to be able to have the choice. Go to the VA center, or let's just give them let's give them a health card, a health insurance card, and they can go get their health care any place they want on the veteran dime, as was promised.
Yeah, well, I mean, I'm in total agreement on that.
Yeah.
I
So
think
the session's over now. We're done.
well, no,
No, we got-
I think there's plenty of other stuff to talk about. But I think one of the solutions is clearly just that: is let's take this multi-billion dollars that we're spending on the Veterans Administration, on the health care piece of it. And Fred, I think, will jump in here in a minute. And the Veterans Administration does lots of other things besides health care. There are other things that the Veterans Administration does. So you're not going to be able to, in my opinion, eliminate the Veterans Administration. But I think that health care piece would be better served if we let the private sector, the market, if you will, govern the health care and give veterans a health care card.
It's not even allowing the market to govern it, because we're giving them a card and the government's paying for it. So I don't think that the market's really all that involved. And clearly we've had this issue for a good number of decades now in terms of veterans health care. No one's been able to fix it. We can't fire these workers because they're all GS workers. You can't fire them, so let's just make their jobs obsolete, like, as you gentlemen have said. Give that card to the veterans. Let them seek health care in the private sector.
The private sector health care has advanced further than what the care that you're getting at the VA center currently in most cases. And again, I'll point out in the very beginning, I think it was the opposite. I think the VA care was tremendous and as better, at least as good, or if not better, than the private healthcare sector. But that's not the case anymore today.
Not since the 70s, at least. Yeah.
Well, and I think there is a free market piece to this in terms of the economy. Is that if there are what do we got, Fred? 7 million veterans walking around out there, you know.
Well, actually, we have about 22 million, but 7.9 million Vietnam era veterans.
Okay, walking around with a health card, you know, that's a pretty sizable force to consider. If you're a doctor, what are you going to do to get them to come to you?
That's true.
So I think there's a free market piece to this in terms of letting the free market dictate the timing of the care. I think the timing of the care would get better. I think the availability of those new techniques that the private sector health establishments have. I mean, to your point, Ed, once upon a time VA care was top notch, but now not so much. The private sector probably does a better job.
They've advanced further past
Sure.
that, and you create some competition, as you said. The doctors will want to have these patients. Hospitals will compete
Sure.
to have these patients, to have this care. And I think that's a good thing, because now they won't have to be waiting and dying before they can get an appointment.
Well, once upon a time when I was in the federal government, that's how you begin a fairy tale, by the way, once upon a time. But anyway, when I was with the federal government, it involved quite a bit in the procurement business. And we always used to say, and it was factual, that the federal system was generally 2 technologies behind. I mean, that's just because of the bureaucracy associated, not bad word bureaucracy, but just the bureaucracy of bringing on new technology. Well, I think that's very true with the VA healthcare system, is that when you go to these VA hospitals, that they're probably a couple of technologies behind simply because of the bureaucratic nature of government and
And the cost and their budget.
absolutely, absolutely. So
The private sector doesn't, I mean, hospitals certainly have budgets, and of course, doctors who have their own offices have a budget they have to keep. But basically, the more patients you have, obviously, the more capital you have
And the
coming in.
problems apparently, though, extend beyond that, I think. We hear these horror stories of hospitals that have hidden lists. You know, the true list of people who are waiting for care, and then you've got the official list that they show to people like the Joint Commission, and they show to congressional committees and that kind of thing. Well, we've actually shortened the wait time, but wait, we have a secret list on here that's the real deal. I mean, when you have stuff like that going on.
What state was that in? There was a state.
Arizona.
It was Arizona. wasn't it? Yeah,
Arizona's
it
been
was
the most
Arizona.
recent one, but there's certainly
Oh,
been
there's
other
been several
examples
others.
of that.
Kansas has been
Yeah,
several others.
Colorado.
But Arizona's the one that first came to light. Isn't that
And
correct?
people like, and then they'll take things like the Joint Commission on hospital care, on health care, that they go around accrediting health facilities, private and public, all over the place, and they'll say, oh, they've rated us as a great sector. Well, the Joint Commission doesn't deal with timeliness of care. They deal with other things.
This is where I'm going to jump in and obviously do the flip side of this. I've been sitting here now for several minutes and running out of time. And this is where I'm going to
Go for it.
politely
Here's Fred.
disagree with you guys. I've had the opportunity to interview and visit places like Martinsburg, DC
I've
Medical
only heard good
Center,
things about
and Baltimore VA Medical Center. And they are becoming, you talk about 2 steps behind on technology. They're at the stage now where the patient can sit at home on his monitor and talk to his doctor straight on.
Oh, that's great.
They can take blood pressure. They can take other measurements for diabetes or for other things. The healthcare in the VA system is probably one of the very, very best in the world. The providers, they're great. It's the administrators, the ones with the list that Carl was talking about. Those guys that get a bonus for
Shortening that wait
exactly.
time, then
They're
it
the
may
ones
not
that
actually be
but the
short.
healthcare providers themselves are the top of the cream of the crop, and they've come along so far in technology that it's improved tremendous, and it's not getting the respect because of all the scandals going on, all these civilians making all this money. And it's unfortunate.
And you do indeed have the last word.
There we go.
Next up, the 2007 Maryland Veteran of the Year, Fred Sinbar, will give us some insight to a veteran's eye.